All right. I hope everybody's having a good day today. Did you have a good day or a bad day? Depends, right? Depends on who is screaming. Did the crown fit? I don't know. Maybe. Did the hygiene show up? Okay. Let's go. Almost there. Are we ready to go? Okay. Yes? No? Maybe? So I'm hearing a delay in mine. Is that okay? I'm hearing a delay. We're good to go? Welcome to our first, hopefully it's a monthly evening with Dr. Dean. My idea was to share different information with you, different types of situations that you guys may be having. Here at the New York Smile Institute, we have a multi-specialty practice. And we treat people, we take care of people, we teach a lot. Education is very important. I'm just getting a little feedback here. Is that okay? But I'm hearing double here. Sorry, hold on a second. I'm getting feedback here. So I'm listening to this. What do I do now? Because they hear me? I'm just hearing double. 1 second. Hold on 1 second. Testing 1, 2. So I have a delay. I can't listen and talk. I can't hear it. It's going to distract me. I can't do it. As I'm talking, I have a delay, so I can't talk and then hear. Bear with us. Technology is working. Hold on. Can I just talk into this? Do that. Testing 1, 2. Testing 1, 2. It's good. We're good? Okay, now we're good. Put back my presentation now. All right, I'm back. Sorry, technology. It's the first time we're doing this, so please be patient. We're going to ask you to send questions, but I want to get through my introduction first. So once I get through my introduction, you can email the questions, or you can actually call the questions in at 1-800-998-6974. Or you can email to drdean17@gmail.com, or to the email that you have there, or you can chat and ask the question that way. But let me get through my introduction. Scott, I just need a little continuing on this. The presentation's got to go. Okay, got it. So the disclosure for today is I have no disclosure. Why? Because I didn't want companies to influence what I had to say. I didn't want to get sponsorship. We got a lot of phone calls to get sponsorship. I didn't want it. I want it to be raw. I want it to be real. I want your questions to be answered. I know there's a lot of people from Asia and Europe, so I want to answer your questions too. I know it's 6 in the morning, so have your cup of coffee. We're going to have a good time. The last 11 years, we've been spending a lot of time at NYU with our faculty. These people have dedicated their time, volunteer work, every Friday at FMR NYU. The company AIC, that's owned by Paul Vigario, Jeff Shapiro, have done amazing things here in New York City to, again, bring education to you guys. So I want to thank them for making this possible. The laboratories, one of the questions we always get asked is, which are our laboratories? These are our tried true laboratories that we use for our implants, for our digital smiles, for our EMAX, for all the restorations. We do have others, but these are the main ones that we use at NYU. Our vision was to take education in dentistry, because we know a lot of you have been through dental school. You spend a lot of money. You have a lot of loans out. You're trying to get a job, trying to pay back your loans, trying to change your life. And then if you're in your later parts in your career, you're trying to figure out how to do great dentistry, how to get to the next level. Well, the interesting thing is that implants, aesthetics, and occlusion, the three most common things in our practice, are not really taught well or the procedures aren't really taught well in dental school. And you get out of dental school and you try to take a couple of courses to figure it out, but unfortunately, the repetition doesn't happen and you kind of lose your way. And that's why we took on this endeavor to really change the educational process of digital technology, of aesthetics, how to really get it to the doctors who really need it. And it has to do with preparing yourself and getting confident. And a lot of it has to do now with digital technology. What you're seeing here is an evolution of different technologies, phones, computers, internet, to be able to bring our office in New York City to your home, to your office, to your facility, to be able to share that information. And being able to be open and honest with each other, asking the questions, getting the answers becomes a very good format. And that was the idea and how we came up with this concept. So I see a lot of things on Facebook, people having a great time. It was a great summer. I hope you enjoyed your summer. A lot of courses out there, beautiful aesthetic dentistry. It's a wonderful platform to share our information. But I always also say to myself, well, how did the next generation get their information from? If I look at it at a photo, it's kind of hard to kind of see what's happening and how the technique was done. I'm just going to change the slide for a second. This thing is off. My questions are off here. 1 second, sorry. I'm not getting this now. Sorry, technology, it's not changing. Let's try to do that. So I see on Facebook, it's great because you get that educational process. Let me see if this works. Okay, that's great. But the question is, how do you really get that information in real time? How do you look and see how you're gonna really do it? I was on the mountain in Greece. That's where you see where I was this summer. And I was contemplating our profession in dentistry. We're very, very lucky. We're very lucky to be able to provide people with a wonderful smile, change them health-wise, make them feel better about themselves, and also change their confidence. But what we have to do as professionals is share that. Now, I was online yesterday and I was looking at the best jobs in US News. Well, guess what? Dentistry is right up there, right? It's number 3 on the list. And it's also, as an orthodontist, number 5. If you go to monster.com, dentist is number 2 on their list. And also you have oral surgeons and orthodontists as well. You know, they're in the top 10. So dentistry is a very powerful position. In Business Insider, this is something I've never seen before. Dentist was top 5. There was a prosthodontist there, meaning the prosthodontists are teaching, and I'm around different areas. We don't know what we don't know. If you haven't seen it and you haven't really experienced it and you haven't even known what's out there, well, how do you kind of know that you're actually missing something? How do you know the preparation that you're doing is the correct preparation? When I give my courses, the first question I ask is, if you have an Emax crown, what's the right preparation for that on a posterior tooth as opposed to an anterior tooth? And that's a different question. So the answer to that is technical. The skills that you learn from dentistry and from dental school are great, but usually I found that doctors, they're not organized in their minds. The information is there, but it takes a while for me to get it out. So what we're trying to do here at IAC, at NYU, at FMR, is to give you a direction, with the right leaders, with the right mentors, and then provide for you your goals, right? Everybody has a different goal. Some people just want to work in dentistry, pay the bills, go back to their families, play golf, have a great life. Other people want to get motivated. Other people want to become better. So it's as much as you want to motivate yourself, we're here to help you educate in New York City, at NYU, and here at my office. Another thing I discovered last night when I was looking on the internet, the amount of dentists retiring is greater than the amount of dentists that are graduating. So you have more dentists retiring than you have graduating. What does that do to the economics of dentistry? The need for dentists is going to be very high in the next 10 years. In addition to, we're living longer. The expectation, life expectancy right now is 78 to 80 years old. So you have people living longer. They need us. Education is the first part of it. Communicating with each other is the second part. Having confidence, that has to do with technique. Doing cases over and over with the right people is going to get your confidence up. Being proficient at it is very important. That means repeating it multiple times till you get really good at it and you can deliver great dentistry. And then the most important thing that I got when I first got out was mentorship. I had 14 great teachers teaching me things that I would never have opened my eyes to, and they helped me. Those 14 dentists are not teaching anymore. So I felt it's our responsibility to give back to the doctors, to give back to the students, an integrity program that really teaches them the right way and helps them grow over time, not just a weekend course, a lifetime of coaching and mentoring. And I think that's very important. And of course, the CE and then your growth. So I want to invite you now to give me your questions. I have some on the board right now. To feel a purpose, to help people, to be successful in dentistry, and enjoy a good lifestyle with your family, travel, and have security. All that comes into a long life of dentistry. It's not just 2 or 3 years. It's a long life of dentistry. So I want to be able to put our doctors and our friends and our colleagues in the right path to learn and become great. To me, you give me a good dentist, I want to make him a great dentist. You give me a great dentist, I want to make him a superstar. That's the capabilities that we have. And those who are just not really there yet, we'll bring them up. So there's no judgment here. It's taking doctors to a good level. First question. Some doctors like to place 1 or 2 retraction cords when doing veneers. What would you advise? For doing veneers, a lot of times we place no cord. Why? Because we don't want to actually touch the gingiva for veneers. For crowns, it's very different. Different levels of tissue. I may use 1, I may use 2. So I try not, in the way we teach our doctors, I try not to have one protocol. I try to look at the situation and have a logical decision of that. If there's a lot of tissue bleeding, hey, we're going to put multiple cords in. If the tissue is healthy and we're doing a veneer, we may not want to put any cord in. Second question. If an asymptomatic virgin tooth developing a severe sensitivity during cosmetic procedures. So if you're getting sensitivity on cosmetic procedures, there's 2 rules there. 1, disclosure. You have a minimal prep situation, you're not going to really get sensitivity. You have a maximum prep or aggressive type of prep. We kind of give them a little bit of disclosure. Listen, 1 of the 2 teeth may become sensitive. So we kind of let them know ahead of time. They may need root canal. Now you're going to base it, if this is a long-term patient or a short-term patient, whether you want to charge them for the root canal. Many times we'll do it on the spot because they're really sensitive and it's fine. Other times, they have to pay the fee. And I think it really depends on your practice. The next question we had was, can you roll that up for me? If a patient for financial reasons can only do the maxillary arch, can we restore the vertical? The answer is yes. So let's say the restoration needed to be 4 millimeters restored, but he only can do the upper arch. We'll go ahead and do the 2.5 millimeters from the upper arch, but we'll also put onlay veneers or onlay provisionals, something temporarily to get the lower arch to actually occlude with the upper arch that's being restored. So we don't want to leave the lower arch in dissembled and very, very off in terms of occlusion, because then it's not going to fit. So we do restorations, minimal composite on the lowers. Sometimes we charge, sometimes we don't charge. We want the case to go smoothly. We'll take care of the patient that way. Next question. Again, you can call in 800-998-6974. What is the time amount that you guarantee your work? Well, each state in the United States of America has a statute of limitation that's 30 months in some states it's 24 months. So we follow the legal rule that anything happens to that restoration under 24 months, we're responsible. Sometimes we'll charge them for the lab bill, sometimes we don't. But you want to have that policy for your office so that everybody in the office, the assistants, the office manager, the hygienist knows what the policy is. Mrs. Jones, your veneer broke. It's within the 24-month period. You know what? We're going to replace it at no cost, or we're going to replace it at a lab fee. After the 24 months, we use what's called sort of a strategic position. If it's 3 years, if it's 4 years, if it's 5 years, depending on the patient. Is the patient a long-term patient? Is the patient a difficult patient? One of those PIAs, you know what I'm talking about. So sometimes like that, we will change our decision about what we're going to charge the patient. Good question. Thank you for your questions. Keep going. Is the other questions coming at all? Yeah. If you were to buy a digital impression scanner, which one would you buy? Well, each year, the new types of scanners come out. Today's world, I'm very comfortable with the Trios. It's very prosthetically oriented. If you're going to do a lot of orthodontics, you may want to look at the iTero. It's very orthodontically oriented. If you want to make your own crowns, you're going to buy a CEREC, and you're going to, or an E4D plan scan to make your own crowns. So in our office, we have all five. We have the 3M Oral Care, we have the Trios, we have the CEREC, we have the E4D. So right now, today, in 2018, every scanner is very, very good in terms of their capability of capturing the impression. But on a ease of use and a commonly used kind of scanner, I would probably go to the Trios. I have to also make one comment on that. You can buy the best scanner and send it to your laboratory. If the laboratory doesn't have a really good printer, the printer becomes the limiting factor of accuracy. So if the scanner is great, but the printer is not, you may not get the accuracy you want. So we want to use laboratories that have the top scanners and the top printer. So printing technology right now is the critical decision on buying your scanner. Let's see, next question. These are great questions, by the way. What is a digital workflow? Well, that's going to take me about an hour to tell you, but I will tell you quickly: scan, plan, mill, or scan, plan, send to your lab, or scan, plan, send, mill. But that's really how it's going to work really quickly to make things work efficiently. But your centers, your offices, 2 operatories, 10 operatories, clinics, they need to be integrated. So the big word here is integrated. Front desk is integrated with the laboratory, is integrated with your operatory, and everything flows evenly. So that becomes a really important tool in the digital workflow, not just what you're doing with one operatory, but how it goes together. Which technology company do you use? Well, we've been using SurfGT for the last 10 years. Why do I use them? Well, listen, things like this. They make things happen. They connect our wires together, basically, so we can perform great dentistry. I'm a young dentist. What 2, 3 things I should focus on a long-term success? 1, you're going to schedule your life. And I tell this to everybody who's been practicing less than 20 years. More than 20 years, you kind of figured it out. But less than 20 years, you're going to do one thing for me. You're going to spend 2 or 3 days a month learning. Meaning if you're working 5 days a week, you're going to have 1 day to go learn something. An office, a clinic, a lecture. You need to focus on education. So my golden plan was work 5 days, 6 days a week, take 2 or 3 days off the month to go learn. Class and a mentorship, mentorship, office. You can come to New York. You can spend a day with us. We have open invitation to all our colleagues, just not all at once. And then what we do, so we have your schedule is that way. You have your business schedule that you're working for. The second thing you want to do is see how kind of person are you? Are you an ambitious person? Do you want to own your own practice? Well, then you better spend at least 1 or 2 days a month on that to try to grow your personal practice if you want to do that while you're working for the associateship for other doctors. If you're not interested in owning anything, you just want to work 2, 3 days a week and you provide for your family, that's great. But if you have ambition to do that, you want to spend those times in that month to allocate to grow. Because if you do that, over a sudden, in about a year or 2, you're going to have your own patients. That's how I started. I started with 1 patient in 1990. We have over 4,500 patients in Manhattan on Fifth Avenue. So that is determination, hard work, education, and find a mentor. I would tell you those are your top 3 things. How long do porcelain veneers last? That's a loaded question. So here's the problem with that question, because the patient asks us all the time. So we say to them, listen, usually porcelain veneers last 10 to 15 years, but there's some accidents. How long does your car last? Your car lasts 5 years. You get a new car, right? Your tires have a flat tire. Things happen. The veneers last a very long time. Is there a problem with them? Yes. Sometimes there's chipping. Sometimes there's debonding, and you'll deal with that. But you assure the patient that you are there for them to take care of them. So you can't make a blanket statement that veneers last 10, 15, 20 years. It's not a fair statement. So I'd like to be very honest with them. I said, usually 90% of the time, they're going to last 15 years. 10% of the time, you're going to have a couple of little breaks and things. How do I get my veneers to match the other teeth? That's another 4-hour lecture. But I will tell you a couple little rules. Rule number 1, what shade are you starting with? what shade are you want to get to. If you're an A2 trying to get to OM3, you're going to use a feldspathic porcelain that's going to get you to a super white color. If you're at D4 trying to get to B1, you got to cut more of the tooth so you have more porcelain. So more porcelain means I can control the color more. If you're using opacers on your teeth, it's not going to look natural. So we have a course on combination cases, which is a veneer, a non-vital dark tooth, and an implant. That's the most difficult to make really match. So we spend a lot of time on color. Use a good laboratory. Call me personally on that because that's a long discussion and I want to get you on the right track. But aesthetically, we want to use feldspathic porcelain for the anteriors, Emax if you're using implants, and then zirconia in the posteriors. That's sort of generally what we do. I don't love the idea of DSOs, but I have a lot of depth options. Work for the DSO 3 days a week, get an associateship 1 day a week, and then work hard to learn the 4th and 5th day. That's what I would be doing. So take the DSO. Listen, the DSOs are providing a good service for the dentists who just need to make money. They need to work. So I don't have anything negative about them. It's just another part of dentistry. You have to make the decision of what you want. You have to be working hard to ambition yourself to say, hey, I want to own my own practice. I'm going to purchase a practice. I'm going to work 5 years for a lot of people. I'm going to learn the business, and then I'm going to purchase a practice of a good fee-for-service practice to get my level to get myself to the next level. So I would, if you're in a big city, that's the way I would go. If you're in a small town, different situation, because you need to, again, there's only limited amount of job opportunities. But the debt, listen, I got at it back then at $250,000 of debt. I'm sure you guys have over $500,000 of debt. So you got to get a job and pay the bills. I get it. But leave that 1 day for education or for yourself to grow, to become better, and to learn the techniques that get you to private practice. At the end of the day, ladies and gentlemen, private practice is where it's at, right? You have your own, you're your own boss, you make your own hours, and you charge fee for service for what you do. Hello, Dr. Banky, thanks for calling in. Which recorder do you use in record jaw movements? Okay, so right now we're changing the way we do that. There's a lot of changes going on with jaw measurements. Kodiak is very, very popular. The Dinar pantograph is very good too, but I am not sold on one of them yet. I'm still searching for the digital option that's really working. Some people have it around the country. You can go online and look for it. So right now we're on that cusp of bringing it. I don't bring anything to the table to my doctors unless I've tried it for at least 2 or 3 years. So I'm in that sort of testing zone. And as soon as I know that, believe me, I'm going to get the word out on what's the best articulator at this point. Can a general dentist prefer an implant surgery? If you're trained, got to get training, not a weekend training, 2-year course in implant dentistry. Implant dentistry, I'm going to tell you right now, it's very, very difficult to learn all the aspects. It's very difficult to learn all the aspects of implant dentistry. There's tissue manipulation, surgery, planning. It's easier today than it was when I was in school or got out, because now you have CT scans, you have beautiful technology that can help you. But you need to take a 1 or 2 year course to really get your skills to the right level. You don't want to be doing surgery for patients and you're not really, knowing what you're doing. So I would say at least 1 or 2 year course. Do I need 2 or 4 implants for overdentures? I tell the patients you need 4, and they say I can't afford it. And I said, can you afford 3? And they say I can't afford 3. So we wind up with 2. So sometimes that's the way it goes. But if you have 4, it's ideal. 3 works, 2 works. It depends on the patient's budget. So, unfortunately, that's how that goes. How are we doing on time? Let me go through a couple of slides before I answer the next couple of questions. Can we just go through the next slide? Hope everybody's enjoying this. Keep your questions coming. Let me just get through a couple more slides that I want to talk to you about. The patient experience. Let's talk about that for a second. That may stimulate you to ask a couple more questions. I want you to think about your dental practice. I want you to think about when the patient first makes the phone call to your practice, who's answering the phone? Critical person. That conversation is very critical. It starts the patient experience. Call a spa, call a hotel, and you will see the customer service that they've been training with. Most dental offices are horrible, horrible. The first person who's calling is very, very important. After that, they look at your website. How is your website? What's the experience on the website? Then look at your office. What's the experience coming through the doors? What is your staff talking to them about? How is your staff demeanor? Are they smiling? Do they have nice teeth? Fix your staff's teeth. They should not have yellow teeth. Dentist, fix your teeth. They're yellow. Sometimes you come up to me, ask me questions. I said, fix your teeth. Make sure your teeth and your staff's teeth are nice and bright and beautiful. Okay. That being said, what's your experience? Well, we have a mobile app check-in, number one. We want them to see us on our mobile app. We want a digital photographer, right? We want the digital photography, digital radiographs. If you're dipping your solutions, I know it's expensive to get it, but if you're dipping your solutions, it's 2018. Please get a digital radiograph. The next experience, hit the button, it's not working for me. Scott, remember Austin Powers? Scott! I'm not getting a click here. Okay, thank you. One, mobile app check-in. Digital radiographs. Digital pre-op scan. So today we're pre-op scanning all our patients. Why? It gets us a documentation for them. It gets us to understand what they have. They can see it on the screen. It becomes a very nice experience. If you have a CBCT scan in your office, 100% use it. It's a great teaching tool. If you don't have one, that's the best investment after your first intraoral scanner, because that shows patients what you're doing with them for implant dentistry. I like to have the patient in the room with CT scans, having them with photographs, and having everything done that day. I don't want them going out to different offices. So if you can plan for that in the next couple of years in your office, it becomes very powerful. Photography. If you don't have an SLR camera, please don't take pictures with your cell phone. It doesn't work. You can take videos with your cell phone, but use a regular SLR camera. And we use the DSD protocol, Digital Smile Design Protocol. Christian Kochman has years on photography, and he's taught us so many things about digital. And I thank him for all his hard work, but we use their protocol for pictures. And then you have your patient experience. So from the time the person makes a phone call to your office, to the time they come in, to the time they look at your website, and then the experience has to all be connected. It has to be smooth. It has to be seamless. There can't be a glitch. You can't have a nice website with an ugly office. You can't have an ugly website with a nice office. You have to be, everything's got to be continuous, and that's a very powerful tool. Question number 15. Does teeth whitening cause permanent tooth sensitivity? We do about 12 to 15 whitenings a month. I don't know, maybe my girls are careful, but we don't have a sensitivity issue. So look at your type of lamp that you're using. Is it old? Is it new? Most of the new ones have a higher power of whitening with less sensitivity, not as hot. So I would look at the system that you're using. But no, we don't see permanent tooth sensitivity. It's definitely temporary. Questions? I need the questions, or I need the program. How do you learn the business of dentistry? We have a one-day course at FMR. The business of dentistry is threefold. Running the business of it, collecting fees, billing, insurances, that's the business of getting paid. What I talk about is the business of how to get your practice from a $500,000 practice in America, not in Europe, $500,000 practice to $1 million practice. In Europe, it would be a $200,000 practice to a $500,000 practice. How do we do that? And the way we do that, a lot of it, I lost my pod. Sorry. 1 second. Technical difficulty. Okay. I lost the other one. As you noticed, I have Greek ears and a Greek nose. So everything doesn't fit. I have very special needs for my appendages. Don't laugh, Christine. Where was I talking about? You got me distracted. I talk about taking the business to a next level. A lot of that has to do with fee for service, number one. Number two, purchasing practices. We have a business plan of ours that we like to incorporate the dentists who have been very successful into our practice and make them superstars. All right. So we take the dentist who's been practicing for 35 years, bring him in, clean him up a little bit, fix up, educate, and then keep his patients here to actually broaden their horizons, do digital technology, and they actually become very productive, even in 3 days. So that was sort of our business plan. It's been working out really, really well. In terms of the business of collection and insurance policies, that's more of the coding and different things that you have to do to get your staff more efficient with the efficiency of dentistry and then billing at the same time. And then your accounts receivable, how you're collecting money. So that's a whole nother lecture. Not going to get into that today, but think about trying to get your systems connected. And if not, hire a coach. You got to hire a coach sometimes to explain to you how to get that collection a little bit faster. And the front desk is a very critical point, as you all know. Front desk person really, really sets the tone for the practice. Great question. What are our thoughts on airway-focused dentistry? Physically in our space, we refer that out. Airway-centric, any kind of TMJ airway. I think also, though, it is a very big tool. So watch what happens. If we have a patient that has a grinding problem, they've ground their teeth down, they're all worn dentition, we're restoring them. What do we do first? CT scan, airway analysis, sleep analysis. Why? It's been known when we restore the vertical, what I noticed when we started restoring the vertical dimension, what happened to the hyoid bone? The hyoid bone is connected to C3. C3 is connected to the whole aperture of the spine and of the neck. If they can get a restoration that reduces the stress, remember, bite plate, restoring vertical dimension, anything that's going to restore that position is going to put a better position on their joint. If that joint is less stressed and more relaxed, all the muscles start relaxing. Hyoid bone goes in, they breathe better. So we do pre-op sleep study with our restoration at this time when they come in with our CT scan, and then during the provisionals, and then post-op. So we're looking at the joint, the breathing space, all along the treatment of that patient. But we will send that patient to the airway specialist to get that kind of qualitative analysis. So it's a very good part of restoring vertical dimension. Is a gold crown still the best restorative compared to PFM zirconia crowns? Well, I'm going to tell you, in my professional experience, I must have done at least 2,000 gold crowns. I actually have 2 in my mouth. But when I was restoring my full arch restoration, I used Emax for my posteriors. I'm not a fan of zirconia, even though it's $1 billion business. I'm not a fan because of the marginal integrity and the preparation designs that have been taught. I'm not a fan of that, but a lot of people use it. Go ahead. So I haven't used a gold crown in a long time. Our go-to crown in the posterior is an Emax crown or a PFM still. We use both. I'm leaning more towards Emax crowns. We do a fair amount of zirconia, but not very often, and mostly on non-vital teeth. So that's our sort of baseline. But I think an Emax crown, adhesive dentistry today, extremely efficient, works well. I can break ice. I can do anything. Those of you who know me, my bite is dead on with Artist Foil. What are the thank you for these questions. I hope this is helping everybody. I hope this is coming off good and you can hear me. What are the basic dental technologies for good general dentists should invest in for her practice? What about his practice? Dental technologies. Scanner, number 1, intraoral scanner. CBCT scan, number 2. Connectivity of your office, number 3. Those are the top 3 to invest in over time. I didn't get my digital office in 1 year. It took me at least 8 years to get to where I am. From the time I met Paul Vigario to now, it's been 8 years of building. So intraoral scan, number 1, CT scan if you can afford it, and the connectivity of your whole office so that the front desk and the back desk and your office are really connected. How do you manage high-end client? A lot of scotch and prayers. They're extremely difficult. We try to have a screening process. It's a great question, by the way, because all of us have high-end patients and a lot of us are stressed out with them. So I don't want you to think that we're taking it easy and we figured it all out. High-end patients, there's 2 sides to the coin. You're going to take beautiful dentistry for a high-end client and they will refer high-end clients. You have to have the stomach for it and you got to know how to say no. My advice. You got to know how to say, no, I can't do that. Because if you run into their circle of the hoops, you know what I'm talking about? They're going to keep giving you hoops and you got to keep running. All of a sudden they got you. I do it the other way. I put my hoops up and they run into my hoops. So that's confidence, security. We're ladies and gentlemen treating ladies and gentlemen. Please don't tell me about my dentistry. You're not a dentist. So you have to talk kindly to them, but they are a big part of our practice. You have to have the stomach for it. So I would say, come and spend a day with us. I think you'll learn how to do that. How do you see dentistry in 3 to 5 years? The DSOs will be taking over many practices, not all of them, many practices. So if I'm a dentist and I need to make money and I'm going to go work for a DSO, guess what I'm going to do? I'm going to work for the best DSO. How about that? How about you work for the DSO that actually really cares about the patient? And they're out there. I've met a lot of the CEOs from them. Believe me, I have very good connections with the DSOs. I appreciate what they're doing on a very important level, is taking care of dentists who need to pay their bills. But some of them work on integrity, some of them work on numbers. You got to figure out, is this DSO the right one for me? And you can have a DSO and be profitable and work for them and have integrity. You can do it. You can do it all together if you find the right ones. So I think search, look at, and interview the other doctors privately, not in their office, outside with a drink, to really figure out if they're happy or not, because you need to do that. Let me just do a couple of points on my presentation, just to keep things flowing. I want to share some materials with you guys and girls. Let's go down a little bit. I can't see too good. Keep going. Keep going. Keep going. I talked about digital. Let me stop here. Hit that. Read this, please. Take a picture of it and put it in your psyche, and just remember, digital technology does not replace fundamental principles. If you get fundamental principles and you have digital technology, you're a superstar. If you haven't developed them because you're young, the digital technology is not going to make you a superstar. The digital technology is just a tool to make things go a little bit faster, a little bit better. But if you give me a true and tried dentist who's been practicing dentistry, and you give him digital, who knows the principles, he becomes a superstar. So the meaning is the digital technology is great, but don't rely on it to make you a better dentist. Become a better dentist. Go to CE courses. Take hands-on courses. Lectures are great. You got to get your hands wet and do the dentistry so you can see it. That's a very important point. This is a digital office. This is not a digital office. If this doctor wants to sell his office, I can't sell his office. We do a lot of mentoring for our doctors who want to buy and sell practices. I can't sell his office, even though the guy's got great reputation. I can take his office and his patient and bring him into this office, and he will double his income. Think about that. Take a good dentist with great fee for service who's got a horrible office and bring him into this facility. He becomes a superstar. Here's the lifeline. Here's the email. Is anybody checking my email? Yeah, good. 800-998-6974. It should be 6974, not 71. 6974. I don't hear any phones ringing. I guess everybody's texting there. Okay, patient treatment, product usage, clinician, your discussion, power of persuasion. Go to the internet, look up power of persuasion. You're a good dentist, you know your dentistry. How do you tell the patient that they need a crown, or they need a full mouth rehabilitation, or they need an implant instead of a bridge? You have to show them with education. For me, pictures and diagrams are so important. So use that for your benefit. You have the internet. I didn't have the internet. I had to sit there and draw everything when I first got out. Now you have the internet, you can have photography. Talk about a patient experience. Talk about accuracy and quality control. Who is your quality control in your office? Is it the dentist? Is it the lab technician? Who's checking your work? I have people checking my work all the time just to keep me honest. Do you want to do same-day dentistry? I found in New York City, time is the biggest thing. Time. Can I save time on this procedure? How can I do it faster and keep the quality up, right? I don't want to save time and lose quality. Quality is 100% your reputation. Your provisional restorations, if you learn how to do them right, is your business card. So you got to learn how to do that. I would highly recommend any provisional course. You said that you see in 3 to 5 years, how about dentistry in 20 years? Oh my God, I don't want to talk about 20 years, 3 to 5 years. I always talk about 5-year plan. On January 1st, I put my 5-year plan into action. I write everything down. And the next year I check it again. 5 years is a good way to live. 5-year plan. Is that Apple iPads in your ears? I don't know what these things are. They just stuck them in my ear. Working, I don't know. They told me it works. As an aspiring cosmetic dentist, do you recommend us to gain knowledge in porcelain veneers? Or not porcelain, what? I can't read that. Give me another question. Questions from the audience. We have an audience here. Thank you for being here. Thank you, everybody. Any questions from the audience? Come on, Christine. No, you got to give me a question. Come on, one question. Oh, porcelain buildup, like core buildup. Like mean core buildup. Oh, composite veneers versus porcelain veneers. So I've been to a lot of countries that cannot afford porcelain veneers. So that becomes a composite restoration. You have beautiful aesthetic composite restoration. The best one who does that is Newton Cardoza. He's in Brazil. He's amazing. So he does beautiful composite restoration. They look like veneers. They're gorgeous. If the patients can't afford porcelain veneers, then you have to take some courses. Ross Nash course down in Charlotte, North Carolina. Newton Cardoza in Brazil, or he comes to NYU as well. They teach composite veneers. It's beautiful technology. And now that the composites, they look they're really lifelike. They're really beautiful. So I think if you're in an area that can't afford porcelain, and you can become a great composite porcelain, composite finisher, I think that's a great thing to do. You gotta look at where you are and see how do I become a better dentist in the facility and the location that I'm in. A lot of doctors come to our course, and I ask them, where are you from? He said, I'm from upstate New York. How many dentists are in the area? He goes, I don't know, about 25, 30 dentists. I said, who's the best cosmetic dentist in that area? And they'll tell me this guy. I said, well, why aren't you the best cosmetic dentist? So what I always feel is that wherever you are in your area, country, city, state, you should try to be the best in that area. How do you do that? Take the courses. Take the courses. Aesthetic Advantage, John Kois, Frank Spear, FMR at our course, right? Take the courses that are hands-on till you become the superstar. You become the Larry Rosenthal of that area. It's 100% doable, right? I did it in Manhattan where it's so difficult to become the best because I worked hard and I took all the courses. How do you recommend a graduating student who wants to be at the top? What's my first step right off school? Get the right mentor. You need the right mentor. You need to know who to follow. I had 14 mentors and they all taught me great things. They all had something to teach. Come to New York. I'd be happy to be your mentor. The whole point of this presentation is that me and my colleagues here at AIC, at NYU, at FMR, we love what we do. We want to be your mentor. We know there's a lack of that. A real mentor, nothing to do with business, having to do with real mentoring and question and answering that you can trust the answers that we're giving you. That's the whole thing. Unaltered, unfiltered, the correct way to do dentistry. And what I always say is get on the right train, right, Christine? Get on the right train. Get on the Dr. Dean train. Get on the FMR train. That's going to lead you into something successful. So yes, you need to get your mentors first so you can follow their way. Do you believe as super GPs or super generals or is the future of dentistry? No, I think the title doesn't matter. I'm a prosthodontist. I don't think that's what made me great. Am I great? Oh. Did I say that? I'm very sorry. Try to keep my feet on the ground. The prosthodontist is the title. I respect the profession. I love that I did that. But that's not where I learned everything. That gave me a great foundation. The super GPs are great dentists. I work with a lot of them. They're great. But they also did the same thing I did. They went and they figured out how to do it the right way. Need some more water. They figured out how to do it the right way. So when you see most of the GPs are out there, they're extremely talented. They didn't just do it on their own. They went and took the courses with the best guys. Every one of them has a history with a top professional, a top mentor. Every one of them. Otherwise, they could never have gotten it. So that's really the key. It's not so much the title that you have or the certificate that you have on the wall. It's who did you spend time with? This is a very eclectic cup that you gave me. This is beautiful. Congratulations. Thank you, Dennis. The dental cup is still alive. So, you can become a general dentist and become a superstar if you have the right mentorship. That's exactly what we're talking about. I'm going to go to the next slide. Take a picture of this slide. How many of these things do you have in your office? You probably have 2 or 3 or 4. If you have all of them, then you're on your way to becoming a superstar. But what I would tell you is let this be your guide of what you should do in terms of connecting for the future for your office. Maybe you don't have the social media. Maybe you don't have the right staff, but you got to push towards that combination of these things have to be in alignment. At least I would say it takes you about 10, 15 years, at least 10 or 15 years. It's a slow process. I had a dentist call me up. He says, Dr. Dean, I took your course. It's 5 years out. I can't do a big case. How do I get a big case? I just can't get it anymore. How do I do it? I said, this is dentistry. This takes a long time. This is not, that's the problem with Instagram. You see it like, oh my God, this guy's doing all this stuff, but he's only done one a year or two a year. So you got to chill, take your time, relax. Things will come, do the right thing. It's a slow process, right? It's a slow process to get to where you want to get to. How did you build your network? How did you build your team? Well, I had one advantage, and I will share with you. There's two questions there. The network was built through restaurants. So I was a bartender for 5 years, pretty good bartender. And I met a lot of people. So I think you have to be in the world of service, bartending, restaurants, hotels. You have to align yourself with these people. That's how you really network in a big city anyway. If you're in a small city, it could be the restaurants, it could be the school. Schools are you got kids, they're going to school, go to the school and just be a good person. Don't give out your card every day. Just be a good person. Just say hello and donate some things. Do some nice fundraisers. We do a lot of fundraisers for the kids, for breast cancer. One of our doctors has breast cancer. We're gonna run a triathlon. I don't know. I'm gonna try to run it. See if it happens. I'm gonna try to do it, but I'm gonna try to raise money. So fundraising raises money, gets your network out. How did you build your staff? If I look at my staff today, and I look at my staff 5 years ago, and 10 years ago, and 15 years ago, that's a growth also. It's a growth in your practice. It doesn't happen overnight. It's very, very, very hard. Staff, I think, is probably the hardest thing. Because to find 10 staff members that really work together well, very, very hard. I think if you have your base of your 2 or 3, you start building from that. If you could do one dental thing differently, what would it be? Wow, that's a good question. One dental thing differently, what would it be? I don't know. Tough question. You got me. What would I do differently, dentally? I don't know. Ladies and gentlemen, whoever wrote that question, I bow down to you. Got me. I don't know the answer to that. I think I'm doing everything right. I don't know. Thank you. Do DSOs have a loan prepayment plans? Do you know? I do not know. I do not know that question. That's a good question. Sometimes maybe they would. I don't know. They should. Oh, by the way, NYU medical school is free. Just announcing that right now. Dental school, you still have to pay. But medical school is free if you're interested. How many operatories do I have? We have 7 operatories. We have a laboratory on the premises. We have a CT scan. Like I said, we have 5 scanners. So, we do what we got to do. Again, if you have a bigger facility, if you have a clinical facility, like 10, 15, 20 chairs, that's opportunity. That's opportunity for growth. If you have 2 chairs and you're trying to build your system, I always say build to grow. So if you have 2 chairs, you're going to grow that. I had 2 chairs for 5 years. I outgrew it. I went to 4 chairs, then I grew that. I went to 6 chairs. I outgrew that, and I came to 7 chairs. So that's just a growing process over your course of your career. And I always say, don't lock yourself in. Keep your options open. Work for some people. Do education. Work for yourself. Have all those options open, because after 7, 8 years is where you kind of figure out what you want to do and where you want to live. So by the way, wherever you want to live is kind of where you want to practice, within 10-mile radius. You don't want to live 50 miles away and practice, 50 miles away. It's not a good thing for you. So try to figure out where you want to live. It's an easier way to go through it. What's the most important habits instill in your team? The 4 H's. 4 H's. Honesty, hard work, being honorable with patients. And the last one, Doctor? Humility. Thank you, Christine. You got to be humble. You got to keep your feet on the ground. So the 4 H's, right? Hungry, you got to stay hungry. You got to be honest. You got to be humble, and you got to be honorable. Thank you for that. Good question. Do you think specialists will have travel to GP offices in the future, or can specialties still thrive in their own private practices? I think it's individually paced. There are specialists that will be the best specialists, and they will thrive on their own. There are some specialists that have a tough time with business, and they're easier psychologically to go from office to office. I don't think they will be eliminated. If anything, the DSOs will pick them up. The big group practices will pick them up. I think specialists are very safe. I think it's a great profession. I think if you're a specialist, more power to you. You're definitely going to carve out a niche. But it all has to do with how hard you want to work. It's all about, at the end of the day, you look at any business across the board. If you want to work hard, you're going to succeed. If you're waiting for everything to come to you, it's not going to happen, not in dentistry. And dentistry, by the way, I got to say one thing. It's all about relationships. when you see me on the podium and I'm talking and I have a sponsor, a certain company, an implant company, a product company sponsoring me, I don't take that very easily. I pick and choose my sponsors depending on what I'm using and who people that I really trust. So for me, it's all about relationships. And that's why we built this wonderful education system at NYU, at FMR, is because everybody there is about integrity. Everybody there is about honesty and doing it the right way. You can be successful and still be honest and still have integrity. So thank you for that. Can I go to my next slide? A couple of imaging. Today, imaging is very important. So you can use DSD protocol. You can use different smile designs. You got to show the patients what they're going to look like. It's a very powerful tool. So any imaging software you can use, Preview, DSD, they're all wonderful. You need to show the patients. I'm just going to jump down because we're going to finish up to my other slide. Can I just jump down? Excuse me. Hang on for a second. Staying uncomfortable. Staying comfortable, sorry, repeat. Staying comfortable is the enemy of progress. Okay? That's a quote from The Greatest Showman movie. It's a beautiful quote. I like being uncomfortable. There's cameras on me. I'm sweating. I'm very uncomfortable. But you know what? We are growing today. We are changing the way education is going to be communicated to all of you. All right? You need good leaders. You need leadership. You need poise under pressure. I want to read a couple of things that I have noted for you. Special for all of you who paid attention today. Dentistry makes some positive impacts in any population in the world. Positive impact. If you join us here at NYU or at AIC or in New York City to further your career, to get mentors, to get guidance, and establish relationships with individuals that care about education, private practice, and helping others through your evolution of your profession to achieve any potential that you so desire. It has to come from you. You got to want it. You want to learn something? Come to my office. You want to learn something? Come to NYU. Come to Columbia. Go to Tufts. Go to UPenn. I'm spending some time at UPenn now. It's all about hard work and customer service. You can achieve greatness. You can embrace the learning process, increase your proficiency in your procedures so you can increase your confidence. Without your confidence, you'll never be able to grow. So increasing your proficiency increases your confidence, gets you more confidence, gets you to understand, and your patients will feel that. They'll feel that 100%. To treat your patients more comprehensively. Ladies and gentlemen, my father told me one thing: integrity, hard work, customer service. I've been doing that since I started. And he's taught me that, and I've held it true. The people that have mentored me through this process the last 10 years are on this screen. I suggest you search them out. Dr. Garber is actually coming to New York in October, and he'll be with us, with Dr. Zuckerberg as well. So a disclosure, I do have to say that some people say I look like Robert De Niro sometimes. So I did a 23andMe, and I found out I was 93% Greek and 7% De Niro. Just telling you. We're going to be at MegaGen in October, symposium in Vegas. We'll be at NYU in October as well, 18th to 20th. Our next live program will probably be in October. I think it's October 10th. And this seat will be occupied by somebody very special. I know you're all wondering, well, who's going to sit down here? Today, nobody. But next time, I promise you, it'll be somebody very special. So thank you for your time. Thank you for listening. drdean17@gmail.com if you want to talk to me privately. 1-800-998-6974 is our phone call, our telephone. And thank you, AIC, for all your help. Thank you very much. So what was your view? What was your view? 200, 300?
Public ratings. It's like